So I'm going to do an examination on your ankle, foot, and toes.
Okay.
Alright, so first I'm going to ask you a few questions.
Okay.
So first, I want to ask, what kind of shoes are you wearing usually?
Tennis shoes.
Okay. And what brand of shoes would they be?
Brooks.
Awesome. And then what surface are you training on or most active on?
Hardwood floors.
Okay. And then what is your typical training schedule?
3 times a week.
Awesome. And then when did you first notice these symptoms?
2 weeks ago.
Alright. And then have you ever injured your ankle, foot, or toes before?
Yes.
Okay. Did you hear or feel anything at the time of onset or injury?
No.
Okay. Have your symptoms been constant or intermittent?
Intermittent.
Okay. Do these symptoms radiate?
Mm-mm.
And then finally, when do your symptoms typically occur? So like morning, night, after activity?
After activity.
Okay, awesome. So, 2 observations I've seen when you first walked in here and as you've been sitting down. I did notice when you were walking in, you didn't have any abnormalities in your gait. Looked pretty normal to me. But I have noticed that you have some higher arches. We call that pes cavus in the soles of your feet. Nothing crazy. So I'm going to do some quick palpations for you.
Okay.
4 quick palpations. So first, I'm going to palpate your medial malleolus.
Mm-hmm.
You tell me if there's any pain or anything
Mm-mm.
like that. So right here, medial malleolus, any pain?
Mm-mm.
No? Just same side. Anything?
Mm-mm.
No? Do your lateral malleolus, any pain?
Mm-mm.
No. Any pain?
Mm-mm.
Move to your navicular right here. Any pain?
Nope.
Okay. Any pain?
Nope.
Awesome. And then I will palpate your metatarsals. All 5 of them. Not feeling anything abnormal. Any pain?
Mm-mm.
Okay. Same thing here. Feels normal. Any pain?
Mm-mm.
Awesome. Okay, then I'm going to do some passive range of motion on you.
Okay.
So first, I'm going to do some inversion, eversion.
Mm-hmm.
So you let me know if there's any pain. No.
Nope.
Inversion. Do eversion.
Nope. Sorry.
Okay. Still no pain?
Mm-mm.
Okay. Do inversion again. Any pain?
No.
Eversion. Any pain?
Mm-mm.
Awesome. And then I'll have you do some active range of motion. So yourself. So first, we'll do plantar flexion. So we're just going down. Good. Okay. And then we'll do dorsiflexion. So no pain in those?
Mm-mm.
Okay. Finally, I'm going to perform the tap/bump test.
Okay.
Very simple. I'm just going to have you back up just a tad right here so I can get a better lever on here. I'll push down right here just to keep it steady. I'm just going to bump here. You keep nice and relaxed. Don't do anything.
Okay.
Any pain?
Mm-mm.
Okay. And we'll do this side too. Any pain?
Mm-mm.
Awesome. Thank you.
Of course.